So my name is Adiola Kwashe, as I said earlier. I'm the program manager for Alfo Healthcare Initiative. I have a strong interest in promoting health of populations and improving healthcare systems generally. A bit about Alfo Healthcare Initiative So Alfo Healthcare Initiative is a non-profit, non-governmental organization. It was founded in 2015 by Mrs. Femi a cancer nurse specialist with over 25 years experience working in the United States, and she's currently the nurse consultant at Marcel Root Cancer Center and Specialist Hospital and Commissioner 4 of Lagos State Health Service Commission. Alfo Healthcare Initiative is community-driven, and we believe in equal access to affordable healthcare across all socioeconomic groups. Our work includes free screening. We sponsor free screenings. We conduct awareness and prevention campaigns, women empowerment programs, maternal and child health. We support primary healthcare centers through medical outreaches.
Sorry, I didn't quite catch that. Could you please repeat it?
Sorry about that.
It's no problem.
Our partners include Optimal Cancer Care, Vivian Fowler, we've worked with COPE, we've worked with Adeniro Ogunsoya Mall, we've worked with Kensington Ade Putu Foundation, Trinity House, Where Woman Healthcare Health Center, General Hospital Bagada Lagos, Beacon of Hope Believers Gospel Church, Precious Moments School and Foundation, Eco Club of Atlanta. Our past projects, Vivian Fowler Memorial Girls, where we had a health talk for the teenagers, talked to them about healthy eating and healthy living and how to stay away from things that could endanger their health, especially at that young age. We also had a campaign, a cancer campaign at Adeniro Ogunsoya Shopping Mall on World Cancer Day, where we spoke to shoppers and even gifted women who we came across free vouchers to get screened at Optimal Cancer Care in 2016. We've conducted Surulere medical outreach about 4 times now, where the minimum attendees over 2-day period has been 800, 900, and sometimes 1,000. That has been a whole lot of work. We've also worked with Beacon of Hope Church. These are some of the pictures from the event. We worked with COPE, on breast cancer survivor conference. It was a 2-day conference where we spoke to breast cancer survivors and had a lot of mental health sessions with them. Also, we had a Baja market awareness campaign for World Cancer Day 2017, Baja market awareness. So these girls are Baja Girls High School students. So we went into the markets, we spoke to them individually, we spoke to people and told them how they could prevent cancers. We spoke to different people because the theme that year was We Can Beat Cancer. And the next slide is talking about the health outreach we had at Trinity Church. We also partnered with Optimal Cancer Care to deliver free screening for the women back then, and our founder gave a health talk. And this was also Precious Moments School. There's a bit of slowing down a bit. So, okay, Precious Moments, we had health talk, and that's the proprietress, that's the owner of the school, proprietress of the school, some of the women in attendance. And then one of the most recent awareness programs we've had was the breast and cervical screening, which took place last November. And we also partnered with Optimal Cancer Care and Bagada General Hospital to deliver this particular screening, and it's been a very successful one. We sponsored 36 women to be screened for free, and it cost us 2,500 to pay for each woman. And so this is the picture at Sorry, there's some slowing down a bit. I really apologize for that. So this is the picture at mammography center at Bagada General Hospital. And we also sponsored for 18 women, 8,000 naira each. We're passionate about helping women. We want to see women live and thrive. And we also sponsored breast cancer for 2 women at the rate of 5,000 naira each, because some of them came in and complained that they had breasts, they had lump in their breast and wanted to be sure. And then if they're not up to 40, then they have to do a breast scan. So we've also had a health conversation. That was where it originated from. And our first guest was our founder, Mrs. Femi Ogunyemi, and we had to glean from our experience being a cancer specialist nurse for over 20 years, 2 decades, over 20 years. And so that happened on Instagram Live. And then the next Alfo Health Conversations is avoiding complications in pregnancy and childbirth, because Nigeria currently has one of the highest mortality rates in Africa and in the world, sub-Saharan Africa. And we thought this is our only way of informing women, because we know that a lot of them are not informed. Information is one of the critical things that let them fall victim of maternal mortality. So that way we were able to, and we got a whole lot of feedback, positive feedback from that event. So welcome to today's event. Today's event is titled HPV Vaccine, to get or not. This is the era where there's a whole lot of noise. I wouldn't say noise, but a whole lot of awareness going on around vaccines and COVID vaccine. So we thought, yes, fine, we're not going to say people should not take COVID vaccine, but obviously there's another one there's another disease that can be prevented, which is cervical cancer, and too many people don't know about this vaccine. Let me just give you a rundown. Is that cancer of the cervix is the 3rd most common cancer among women worldwide, and statistics from Globalcan says that there's an estimated 569,847 new cases and 311,365 deaths in 2018. About 14,943 new cervical cancer cases are diagnosed annually in Nigeria, and this estimate was from 2018. Cervical cancer ranks as the 2nd leading cause of female cancer in Nigeria. Cervical cancer is the 2nd most common female cancer in women aged 15 to 44 in Nigeria. And this statistics is from the IARC Information Center on HPV and Cancer, 2019. A little bit into data again. As at 2018, 111,950 cases of cancer was recorded. There were 70,322 deaths. People are dying. It's not, we're not just talking about, we're talking about lives here. And the good part of what we are in now, and one of the reasons why we've organized this program, is that in 2020, on the 17th of November, Dr. Tedros made a call to actually assemble the World Health Assembly to pass a resolution calling for elimination of cancer and adopting a strategy to make it happen. So what this means is that the WHO has finally said, oh, cervical cancer, we should actually tackle cervical cancer. We're going to do all we can to tackle it. We're going to make sure as many women are vaccinated, as many women get pre-screened early. And this is an opportunity for us to actually put in all we can to eradicate cervical cancer. I can't imagine the stress and the effort a woman has put in to take in, deliver, take care of her child, go through all the stress of nursing and parenting a child, and then all of a sudden in her 50s, in her 60s, when she's supposed to be resting, cervical cancer comes from nowhere. It doesn't make sense. So this is our only way of saying, yes, we need to do something. And we thought, who else can we bring other than Dr. Femi Olaleye, who is the medical director of Optimal Cancer Care Foundation. Good afternoon, sir.
Good afternoon, Adela. Good afternoon, everybody.
How are you doing today, sir? Good to
Thank
have
God.
you. Good to see
A
you.
typical busy clinic day for me, but hey, when the other says she wants me at 4 o'clock, I have to stop everything.
Who am I? I'm just a small girl, sir.
No, you're doing great things, and congratulations with all the achievements and the landmark milestones you've achieved for the foremost partner in our journey and in our work against cervical cancer in Nigeria. Thank you very much.
Thank
well
you.
done.
Thank you, sir. Thank you, sir. So I'm just going to read, before I invite Dr. Femi, I'm just going to read his profile. So really, the reason why we're here is HPV vaccine is one of the ways that has been noted with results that can prevent cervical cancer. So we want to know, what is this vaccine about? How does it work? How can I get it? You know, are there any side effects? A lot of people have questions, especially when it has to do with vaccines. You know, how long does this vaccine last? Who is at risk? What do I do? How can I get vaccinated? And so that is why we have brought Dr. Femi here today. So I'll just read his profile quickly and then he comes on board. So Dr. Femi Olaleye is a clinical entrepreneur, a skilled health specialist, a health project manager, and a prudent business administrator. Dr. Olaleye graduated as a medical doctor from Obafemi Awolowo University, Ile-Ife in 1991 and proceeded to the United Kingdom shortly afterwards to commence postgraduate training in obstetrics and gynecology. Dr. Olaleye took a year off to acquire a master's in business administration from Imperial College London, where he also acquired a diploma of Imperial College. Dr. Olaleye was appointed as a clinical fellow in obstetrics and gynecology, Durrant Valley Hospital, Dartford, Kent, and he was in this position for 4 years before he resigned in 2008 after a total of 10 years of service in the British NHS. He returned from the diaspora in 2008 to establish 2 enterprises, and he's the CEO of Optimal Healthcare Limited and Medical Director of Optimal Cancer Care Foundation, Nigeria. Over the years, since returning from the UK, he has been using his clinical and management skills to care for people, especially the less privileged and those living in the grassroots through his NGO. His foundation designs and delivers free and affordable cancer screening services for men and women across Nigeria. He is also passionate about improving clinical governance in healthcare and reducing the cost of medical errors in Nigeria through clinical risk management. He has received several media attention and also featured in documentaries locally and internationally. He has received accolades such as the Niger Diamond Award by Diamond Bank PLC, the Charity Award by Ovation Red Carol, and Development Marketplace Award for Diaspora Entrepreneurs from the World Bank. He was awarded African Medical Doctor 2015 in Berlin, Germany by Global Change for Africa for his impactful work in the area of cancer awareness and interventions. Dr. Olaleye's work has received endorsements and partnerships from no less than 7 first ladies, that is the wives of state governors, and several corporate bodies, including Access Bank, Airtel, Nigerian Bottling Company, 7-Up Bottling Company, Equatorial Assurance, and GlaxoSmithKline, which is also known as GSK, to mention a few. Dr. Olaleye serves his community further as a member of Lions Club International and as a member of the medical board of Archbishop Vine Memorial Cathedral Church, Ikeja, Lagos. Dr. Olaleye is indeed a solution-minded and vision-driven change agent. Ladies and gentlemen, please welcome Dr. Femi Olaleye.
Thank you, Diola. I can't imagine you read all of that. But thanks for making that effort and thanks for being so sweet reading that out. Good afternoon, everyone. I guess I have the floor now.
Yes, sir. You have the floor now, sir.
Yeah, Francie, we can. Did we get the slides, or I'm uploading from my side?
Okay, I'm uploading from here, sir. But you can also do that if that's more comfortable.
I actually don't have the slides on this computer.
Okay,
and that's a challenge. So kindly help me upload them. So good afternoon, everyone. The aim of what we are trying to achieve in the next 30 minutes is to basically turn all of you into advocates. Because most of you who have taken time to tune in today are probably educated enough to know what we're talking about. You possibly can even find out most of the information yourself. But what about those around you? What about you can impact with this information? And that's why we put together a few slides so that when you are engaging people in raising awareness, you sound more authoritative. You'll be able to pass on that information to them as cogently, as clearly as possible. So the whole essence of doing this seminar is not just to raise awareness. It's also, obviously, like I mentioned, turn into advocates, also to get you to get screened. And when you've done your screening, move on to the next level, which is vaccination. Vaccination is available now, like you'll find out from me later, across Nigeria. Some hospitals offer it, some don't offer it yet, but you know you can easily get it if you make inquiries. And if you come to us or to Alfo Healthcare, you'll be pointed in the right direction. So if I have the slides that I want to see on my screen share, I'm still looking at your screen, Yola. Okay, unmute yourself if you can. I can hear you. Okay, there you go. What did you say?
So I'm sharing my screen and I have your slide up, sir.
Oh, let me refresh for me, please, because I don't have you.
Okay, sir.
I still have your old slides. Okay, so let's start again and then share again. There you go.
Okay.
There you go. I think that will work very well. So HPV vaccine to get it or not. So advance to the two slides after that, which is slide number 4. Slide number 4. Yes, let's start with that. The cervix, what is the focus of our discussion today is the cervix. And therefore, I felt it's important to, let's start from the morphology, the structure of the organ that we are interested in talking about today. The cervix is the neck opening where the menstrual flow, the period of the woman comes through every month. It's a very tiny little hole at the top of the vagina that connects to the inside, which is the womb, the uterus. The cervix bears the brunt of the physical and the chemical interaction during sexual intercourse. And when a woman is sexually active, the first thing she would notice is that the cervix starts changing as a result of the HPV virus that's been passed to during the intercourse. I'll talk more about this virus in a minute. If you look at the womb again, you'll notice that the cervix is way up in the vagina, far away from the outside elements. Unlike the male genital organ, our genitals are hanging outside our body, just covered loosely with skin, which means it's easy for us to pick up elements from the environment, infections, but our skin being the protective cover for us doesn't allow infections to penetrate. Unlike a woman, when she's penetrated during intercourse, that defense has been breached. And that explains the simplicity of HPV infection in women. With just one sexual partner, it's easy for her to get infected. Let's go to the previous slide. And then I can show another picture of the womb, of the cervix. That's how tiny the cervix looks. And you can see in this picture, I mentioned there that the cervix also widens to allow a baby to be delivered. So in obstetrics, we assess the cervix of the woman during labor to be sure she's ready to push the baby through that tiny hole, which would have dilated during the course of labor to what we now know as full dilatation, or approximately 10 centimeters. Then when that happens, the baby comes out and the cervix has to close again after the placenta, the afterbirth has come out. So it's a very functional organ for the woman. All right, so let's now go to slide 5. So cervical cancer is actually now caused by this virus we now know as HPV. We didn't know this before. For about 4 decades, we knew it had something to do with sex. So we started thinking, oh, maybe it has something to do with promiscuity. We started wondering, oh, could it be, HIV? Because we saw a lot of women with HPV and cervical cancer when they had HIV. Then sooner or later, we started obviously identifying HPV DNA in every specimen of cervical cancer. So that's why the dots were finally connected. Pap smear, Papanicolo, that's George Papanicolo, who invented the pap smear, was the first to make that connection between sex when he smeared Catholic nuns who shouldn't normally have sex, who for some reason are getting cervical cancer. And he was able to identify that, oh, abnormal cells are given off from the cervix years before it leads to cervical cancer. So he perfected that smearing technique, which we now know as Papanicola's smear. Now, technology many decades later brought the electron microscope. And with the electron microscope, now we know for a certain that it is HPV that is connected. And how do women get HPV? Go to my previous explanation. The only way HPV can get to the top of that vagina is if somebody penetrates her genitally. Okay, that is how we now know the connection. And it shouldn't be what we should be talking about now in the 21st century, decades after we have discovered all what I've just told you. But lack of political will, lack of awareness, lack of education on the part of government, public, and women particularly. Cervical cancer still killing a lot of women. Diola shared some statistics from Globocan, which is still sad reality of our existence in Africa. I have some slides later to show a comparison with other countries where they are doing the right things with regards to safeguarding the lives of their women. So if you think about a disease that takes almost a decade to develop, giving us doctors and carers an opportunity to intervene and stop it, then it's not rocket science. We should do all we need to do to prevent that disease from happening. Then about 10 years ago, science also gave us another bullet against this, a magic bullet against this HPV, a vaccine that has been shown to work, that has been shown to be effective, that has been shown to be safe, that has been shown to reduce the incidence of not just cervical cancer, any HPV-related illness like genital warts and anogenital cancers as well. So we are here to basically expose this information to us and get us going and take action. But let me tell you more about HPV. We know a lot about this virus. Next slide. Yes, HPV is basically a very weak virus. The whole global community right now, we all are afraid and scared of one virus. We all know the name, right? Coronavirus. Yes? So it's a virus, like human papillomavirus. I'm sorry, HPV is a virus like coronavirus. But coronavirus attacks us through organs. HPV attacks women through their genital organs. Just like HPV, just like coronavirus, there's not a vaccine and a mode of protection against coronavirus. The same thing applies to HPV. Unlike coronavirus, HPV is actually a very slow virus. It doesn't cause the disease immediately. I could be exposed to, God forbid, I could be exposed to coronavirus last week and I could be ill. God forbid, my enemy will be dead by tomorrow. But not HPV. It takes decades, it takes years. And it's not every time you get a virus doing that to humanity. HIV, we all know, is another form of virus. It kills. But HPV cannot on its own kill. It has to go through a process where it transforms, it makes the cells of the cervix to go abnormal. Before your inactivity, your ignorance as a woman, or the public health system inactivity allows the HPV to now turn to cancer and now kill the women. So that's the perspective I want us to have comparing HPV and coronavirus or HIV. And unlike coronavirus or HIV, these other two viruses, they have a global impact affecting people across continents, across borders. So other countries want to protect their citizens. They want to limit the spread of these diseases. So they rush forward to get therapeutics, get vaccines across to the world so that the disease body will be low. The transmissibility of the virus will be low. But sadly with HPV, because it's a genetically sexually transmitted disease, there's no motivation on the part of the developed world to help the developing countries. If you like, they're sleeping with each other and they're giving each other HPV. It's not going to cause health problems for somebody in America. And that's part of the reason why third world countries still bear the worst burden of the disease caused by HPV. All right? HPV, there are about 57 types of them. About 15 will cause cancer. We call them oncogenic. HPV 16 and 18 are the commonest. The non-cancer causing ones are the non-oncogenic, and 6 and 11 are the commonest. And those ones cause the genital warts that we know commonly that we see in women and men as well. Okay, next slide. I'll probably come back to this slide later because the vaccines are designed against those four viruses I mentioned: 16 and 18, 6 and 11. So just remember those 4 subtypes when we are talking about the vaccines later. So let's look at a young girl who's never had sex before. This would be what a cervix would look like. Immediately a man comes along and says, "Hey, I love you." I call it the tragedy of the "I love you" story of women, because you are stuck as women. You believe a guy when he says "I love you," and you all know what happens after that. You fall in love and then sex comes to play. And the first 3 years of sexual exposure, HPV, doesn't do much to the woman's cervix. But let's go on. Just click the next 10 forward slides. Just 10, 3, 4, 5. Keep going. 8, 9, and 10. One more. That's it. Stop there. This interactive, slide has shown you clearly the progression of HPV in the woman's cervix. So the gray stacks of cells are normal. With the presence of HPV, the cells become dysplastic, meaning abnormal. But they don't become cancerous until decades later. And this is the science behind screening women every 3 to 4 years. Because if you screen a woman during the moment when the infection is still very early, you can cure it. But if you ignore or you don't screen women regularly, the infection progresses to stage 1, which we call CN1, which is still low grade, intraepithelial lesion. But when it crosses to stage 2 and stage 3, those are already high grade. And we can see these lesions when we do a screening, a visual inspection screening or a pap smear for a woman. But when women present in our countries, particularly African countries, they present when 2 decades later, when the case has become inoperable, it's already an established cancer. And that's why every woman should know about this. Once you start being sexually active, once you know about HPV, you should go get checked and get your vaccination as well. All right? Let's see what the next slide says. The next slide, please. Okay, I did mention earlier that I was going to do a comparison of the data that is obvious to everybody now. Viola shared global cancer data of 2018, 2019. I still have one from 2008, which was 10 years prior to that. And the data is still the same. Interestingly, because we are not doing anything about this disease over the past 10 years. Other parts of the world have been institutionalizing. You know what I mean by that is they've created agencies and institutions to prevent cervical cancer. Is that serious? We don't even have a small, tiny agency in Nigeria. Let's start from our country. We don't. In other parts of the world, they've created institutions that have this funding, that have policy backing it. So look at that. The incidence of cervical cancer is 1, 2, 3, 4, 5. The mortality, that is how many women are dying from cervical cancer in Europe, is almost dropping off the radar. Let's compare this same data with Africa. Next slide. And you see clearly, for emphasis, I painted the cervical lesions green. So click on the next slide. You jumped it. You'll see the green data has jumped to the top of the league. Okay. This has jumped to the top of the league. That means cervical cancer is actually killing more women than breast cancer. That means breast cancer still remains obviously the number one in incidence, followed very closely by cervical cancer, but a flip in the death rate, simply because we don't do enough. We have not been doing enough. So kudos to the Alfo health cares of this world, the optimal cancer cares of this world, and our partners. Well done, Adiola, and your colleagues at your company and your organization, and my own colleagues at Optimal Cancer Care Foundation. Two of them are on this program right now, Demiloju and Nebere. We can't stop talking about this, because in this data up there is somebody's mother, somebody's wife, somebody's sister, somebody's friend, somebody's colleague. Is a citizen, a law-abiding citizen, a woman who is important to the society, who could even help us raise the next champion for Africa. But they are dying in their mid-40s because we are not doing enough to prevent this disease. So kudos to everybody who is making this happen, to raise awareness. If it's just one woman we're able to influence with this information this afternoon, we have saved a future generation. Okay, so I pray none of us will have this kind of data, our relatives in this kind of data, in Jesus' marvelous name. Amen. So next slide. So this is what a normal cervix should look like. This is what an abnormal cervix should look like. Let me move on very quickly through this so that I can talk about the vaccines and why women should take the vaccines. So if we find a woman with a normal cervix like this, we say, thank you very much, madam. Your cervix is fine. Go and take a vaccine. Because if you're still going to have sex, I cannot guarantee the cervix will continue looking like this. Because HPV is going to come along and change it to become cancerous over time. Next slide. Like I pointed out earlier, cervical cancer doesn't happen overnight. It takes a while for this to happen. So screening regularly allows us to detect. And then once we've detected it, next slide, we intervene. We remove the abnormality by a process called cryotherapy. Next slide. By freezing that abnormality out of that woman's body, she can be cured of this disease. And then we institutionalize or institute, we commence a vaccination program, a schedule of 3 doses over a 6-month period. And that woman is covered for the rest of her life. Next slide. Next slide. Yes, that's what that looks like. If cryo doesn't work, we can obviously use a loop, which involves using electricity, charging through that loop wire to remove the abnormality from the woman's cervix. And that on its own is enough to cure that woman from cervical cancer. And we've done quite a lot of this foundation over the past few years. We've been working with this. Can you move to the next slide for me? Okay, so we now know that we can offer protection to girls and women against cervical cancer. There used to be 2 types of vaccines available in Nigeria: Gardasil, brought in by Merck, and Cervarix, delivered to us through GSK. However, Merck and Gardasil are no longer available in Nigeria, and I can assure you Cervarix is doing just as well because it's focusing on 16 and 18. Gardasil protects against 6 and 11, which causes genital warts. But genital warts are not life-threatening. They can't form cancer. So I'm quite happy to stick with Cervarix, which takes care of the oncogenic viruses 16 and 18. Okay? 3 doses are taken. They're very safe. And there's no reason why women and young girls should not take these vaccines. From the age of 10, young girls are advised to take this vaccine. Next slide. So how do they work? How do vaccines work? Remember I mentioned HPV is a virus, it's a foreign organism. So once it enters the woman's body, your body recognizes it immediately as an antigen or a foreign body, and it produces antibodies against it. But the natural antibodies are not enough. They're not strong enough to deal with this disease. So what scientists have done is to introduce the HPV through a vaccine method and inject the woman in 3 successive doses, month 1, month 2, month 6, to generate enough antibodies to neutralize the impact of the HPV when the woman has intercourse and is exposed to this virus. So why do we give it to young, pre-sexually active young girls? It makes sense. You give them the vaccine to build up that immune response so strongly by the time they are mature enough to start having sex, it's of no effect to them. Because a woman continues to be at risk throughout her sexual life. At risk. Because if you have sex with somebody yesterday, you don't know who that person is going to have sex with today. You cannot guarantee that that person is not going to bring another type of virus to you tomorrow. That's just nature of human beings. And therefore, the best way to protect our women is to make sure that, okay, you check your cervix this year, 2021, your cervix is fine, but you're still in your 20s, you're in your 30s, you're in your 40s, you're in your 50s, and you're still sexually active, you will benefit from the vaccine because you continually are exposed to this virus through your sexual activity. And that's exactly how these vaccines work. And like I mentioned previously, it's been documented, it's been researched. We know so much about this vaccine that I can tell you, you will be making a good investment if you invest in taking vaccines for you, for your daughters, for your sisters, for your nieces, for your friends, for your neighbors, anybody you think you can inform about taking a vaccine, please do so. All right? Next slide. Okay, so in summary, I'm pointing out that vaccination can start from 10 years. Vaccination offers lifetime immunity. Once you've taken the 3 doses, you are immune. You don't need to come back again to take any booster doses. Unlike what we know about our latest pandemic, which is Corona, we don't know how many vaccines you need to take yet, but we are learning as we go along. But that's not the case with HPV vaccine. We know so much about this, and we have documented enough of that evidence that it's a very effective vaccine that women should take and young girls as well. In addition, you can abstain from sex and limit the amount of your sexual partners to reduce the risk, particularly to the woman. Okay, and girls, screening starts from exposure, and I always encourage mothers, let us protect tomorrow's mothers today by giving them the vaccines that are necessary against HPV. So on that note, I think I have been able to convince you, not confuse you, with regards to the HPV vaccine. Okay, thank you very much. I'm not sure whether there's any other slide after that. Usually I put bonus slides at the back. Yes, I think I have a bonus slide. Think cervical cancer can ever happen to your daughter? Think again, that's if you have a daughter. And if you are young enough to think, oh, only cervical cancer affects older women, think again. Based on this seminar I've just shared with you, you should know now that it can affect anybody as long as sex is involved. All right, thank you very much. Thank you. Yes, that's my contact details. Want to follow me on Instagram or Twitter, please do. And if you have questions, you can ask right now. You can ask right now. I'm sure Diola can moderate the questions, but if you want to send me a WhatsApp later, that's available on this number as well. And that picture captures the essence of the advocacy efforts we do at my foundation. We reach women wherever we can, wherever they are, and with the best method available to us, we drag them into our clinic to get vaccinated, to get screened as well. So please help us do the same and spread the message of cancer awareness. And let us join WHO, who now has a commitment to eradicate cervical cancer as a disease on this planet. God bless you all.
Thank you so much, sir. We really appreciate your time. Thank you so much for the detailed for the detailed explanation and the detailed, and what I'm taking from the session is the fact that other countries have institutionalized it, and I hope that in Nigeria we'll get to that point where we'd actually understand that this disease is not just about eradicating it with our mouth. There's a lot of action that is involved. Mrs. Kemi Oguyemi is with us here. Hello, ma. Our founder she's joined us.
I'm here. Thank you so much for such a one. Can you hear me?
Yes, we can hear you, ma'am.
Oh, thank you so much.
Yeah, hear you, madam.
So I know quite a bit about cervical cancer, but it's always never know too much. And really, really happy with that presentation. And I'm sure a lot of people will obviously more knowledge and create that awareness. I do have a question though. My question is, how do we ensure that people are really aware of vaccinations and not just be educated and meet those in the health sector? Because one, I know it's not free, so that's always an issue. And so, how do we, in your opinion, apart from NGOs like us, pay for some people, even us, we can't do it alone. But how do we partner, say, with the government, Ministry of Health, federal government, that look, we now buy this involved, ensure that the places where people can actually get this
excuse me,
vaccination.
hold on a minute. Hold on.
Yeah.
Diola, kindly mute Olaleye Azan's phone. He's picking up audio. Or mute, please mute her. I couldn't hear all what Madam Kemi was saying.
Oh, apologize.
Olaleye Azan.
Yes.
Mute her, please. Sorry about that. Can I
That's okay. Yeah, sure. So just saying that, yes, people like me and some NGOs in the health space and, doctors and all that, we know about the vaccines, but how do we get it out there to the people because it's not free. That's just the bottom line. It's not free. How do we get it out there to communities, young girls? How do we convince people that this vaccine is for this? Cervical cancer is like, way up there, close to breast cancer. And in your opinion, how can we partner with the government, federal government, to say, let's have places where they can actually give this vaccines and just create that awareness and get other people to, because it's not cheap. It's 2 doses, I believe. I know I've tried to talk to Merck. I know they do that sale. I don't know whether they do the other one as well. I know somebody in Merck. I said, well, if you get the numbers, we can work out a deal. I mean, that's what I always say. So how do we do that? How do we get people to know about it? Just like they know about the COVID vaccine.
Thank you. I did mention earlier that it's a disease of ignorance, really, and the ignorance on 3 levels. Members of the public, political office holders, and of course, the women themselves. And so to get women to move from knowing about the disease to taking action, to now investing in taking vaccines, it's you cannot rely on only one leg. The tripod has to be there to do that. And the tripod usually it will be policy. There should be a government policy, just like we have a policy on immunization. Every child in Nigeria should have immunization through the extended program for immunization, EPI, right? And that policy is backed with funding. So
yeah,
every mother now knows that once I have a baby or I have a child, I'm going to have to take immunization and I don't have to pay for it because it's funded. So the same thing we can do with regards to HPV vaccination because you need government policy to back it. You make reference to coronavirus. The reason why everybody knows about, the efforts of preventing and taking vaccination against is government, public health policy, driving it, and then providing the vaccine. The vaccine shots given in Nigeria so far have been free. Because again, I made a distinction between coronavirus and HPV because but actually it's a deadly virus. It kills women every hour. through the ignorance of our healthcare system, the long-term effect is that a woman dies from cervical cancer every hour in Nigeria. That's 24 in a day. I'm not sure if you are still keeping track of how many people are dying from coronavirus. I'm not sure it's up to 20 a day right now in Nigeria. All right, so that's the challenge. We need to move our government policy makers and people in government from a position of, oh, that's not important, to a position of, oh, this is vital, like they've done in other countries. Then while we are waiting for government to wake up, individuals too therefore need to start the very, very expensive vaccines. I agree with you. But for those who actually can afford it, let them start making demands and requests for it. Because when they start requesting for it, you know what happens to the economics of demand and supply. When there's a demand for something, there's a supply for it, then the price will start doing what? Coming down. To a point where governments can now start saying, okay, we can subsidize this. We can partner with organizations. Even corporate organizations can start saying, oh, wow, we can take half of that burden of women. Right now, it's still a very expensive vaccine. So when you tell people, oh, this vaccine costs this much, push back. They want to say, oh, no. But in this vaccine, in the affordable range, right now it's about 15K per dose. So if it's an affordable range of, say, 3,000, 4,000, it's easy to say, you bring 1.5, I will add 1.5 to it. So those are the intricacies of the economics of doing this.
Yeah.
Other countries have successfully requested for Gavi assistance, which is an alliance for vaccination across the world. And the Global Alliance Against for Vaccination Initiative, that Gavi stands for, is designed to help poor countries to get on the vaccine dynamics. But Nigeria has not been qualified as a poor country just yet. So we have not been able to achieve any support from Gavi with regards to HPV vaccination.
Yeah, of course.
So
yeah,
the focus therefore is now left in the hands of NGOs like you and I.
Yeah.
The best I can do at my NGO is to give
Exactly.
discounts. And on Children's Day, and Children's Day is coming around the corner now, we give a massive discount, almost 50% discount for young girls who come to our foundation from May 27 to May 29. They pay only
That's
10,000
good to know.
naira. And if you wants to help us,
we will.
Later, I'll be happy to pass that.
Thank you so much. Appreciate that. Thank you. Thank you.
Thank you, sir.
Can I ask you a
question?
Yes,
sure, you can. Yeah.
What part of the world
I'm in
you?
Lagos. I'm in Lagos. I'm actually.
I
know. I'm outside Bagada. I'm actually outside Bagada. I'm with the governor and the commissioner for health. They're opening the oxygen plant, and so I can show you. Important. I can show you.
That's
there you go. I mean,
can
you see me now? I'm in Nigeria. Can you see? And there's some policemen. They're guarding me. They're protecting me. Yeah. Right. I wish. Yeah. So that's
well done, and keep up the good work with
no
Alfo.
problem.
Well done, and
Thank you so much. Thank you so much for the partnership.
Sister.
Thank you. Bye.
Thank you, ma. Thank you very much, ma. So, sir, we have a question. A question. The question says, can a woman still be at risk if she has a faithful partner who doesn't have extramarital affairs?
Okay. 2 ways to answer that question. I am taking that person's word for what it is, faithfulness, 100% faithfulness, okay? And if that is guaranteed, the risk is minimum. But the risk is still there. Because the virus of that man himself can cause cervical cancer in a woman. But the risk that she's exposed to has reduced because of his faithfulness. So she still needs the vaccine anyway to protect against the gentleman, the faithful gentleman. All right?
Yes.
Hope that answers the question.
I believe so, sir.
Yeah.
So there's another question. Yes, I said I was screened in 2019, got pregnant almost immediately, then COVID happened.
Okay.
So my first dose of the vaccine was in March 2021. Does the screening in 2019 cover, because I didn't have another screening before the vaccine? So she was screened in 2019, and then she got pregnant, and then COVID happened, and then her first dose of the vaccine was in 2021. So she's saying that there was a screening in 2019 cover her because she has not had another screening before she had the vaccine.
Absolutely. I will recommend another screen. If that had been my clinic, my foundation, in 6 months, you should repeat that screening before we institute vaccination. So I would recommend her to get another screening done, at least before she finishes vaccination, which would be in September. So she should do another screening in September. That answers that question. Excuse me, please. Thank you. I have a bit of cold, so I'm taking care of myself as well. All right,
please
go on.
Take care. Okay, so another question from Olaleye Motipe says, for the young child of 10, will she be screened before having a vaccine?
Obviously not. Well, it's a good question. No, we assume the young girl is a virgin and therefore not sexually active yet. And therefore we will ask for the vaccination to be commenced. And when that's it, we just do a simple breast examination and commence the vaccination. No screening need to be done. But we have to confirm that question. Sadly, a lot of young girls have been sexually abused. We have documented cases of young girls in their teenage years already sexually active. So we will ask them, are you sexually active? And the answer usually no. And then therefore we go ahead and give them the vaccine. Okay?
Great. So there's another question, sir. Is the vaccine for girls only? So can men also take the vaccine?
It's a good question. The vaccine that's available in Nigeria now is not for men. That's to men. It's only against 16 and, for example, now in the UK, is actually Gardasil. Gardasil has the 16 and 18 components and the 6 and 11 against genital warts. So the theory is if you give the men the genital warts vaccine, you are reducing the risk of transfer of genital warts to, obviously, to women. But more importantly, in that society, they have liberal sexual tendencies, which basically encourages homosexuality. We have now confirmed that HPV causes anogenital cancers, and this is commonly seen with homosexuals, particularly cancer of the penis, cancer of the anus. And therefore, if a man is given this vaccine, you are reducing, if it happens to be you are reducing his risk of HPV-related anogenital cancers, and that's where that is coming from. So, so I need that to be put into context. So, if a young man in Nigeria who is not likely to be a gay guy or homosexual, given the vaccine that we give to women in Nigeria is a total waste of investment. Okay.
Okay, thank you, sir. So there's another question as well. Please, is there need for screening after completion of the 3 doses of the vaccine, since it offers protection for a lifetime? So I've got the vaccine and it's offering me protection for life. So why do I need to screen again?
Good question. If you go back to, I don't want you to share screen because of the time it will take. I can try and explain it. If the person asking that question was here during the seminar, you remember that slide where I showed you the natural history, the progression from normal epithelium to cell 1, 2, and 3. You see that it takes years for the disease to develop. So if a woman already becomes sexually active and she now comes along to take the vaccine, we certainly will see no evidence of the disease on her cervix. Give her the vaccine. But that doesn't mean that that virus that's in her will not reveal itself as a disease years later, because the vaccine will not treat. It can only prevent fresh incoming infection. It will not backdate it. It will not go back and treat or prevent the virus that's already started to go along that line of CI1, 2, and 3. And that's where it is dangerous to go to offices and corporate organizations, because I've seen some of my colleagues do that. And right there on the desk of these young women, they say, oh, madam, there's a vaccine for cancer. I say, oh, yeah, give it to me here. And they just jab them. One, they have not checked them. Two, they've not given them information that, oh, we need to check later because you're already sexually active. And some women are out there thinking, oh, I've already taken a jab. I don't need to go back and do a checkup. I'm sorry, science has not told us otherwise. Because you have become sexually active before you take your vaccine. Yes, you are protected moving forward, but at least for the first 10 years, since the first 10 years after you have taken a vaccine, go back at least and check 2 or 3 times to be sure your previous exposure has not in any way caught up. If you don't mind me use that word, caught up with you, as it were. All right? Young girls who are not sexually active, teenage girls who are not sexually active by the time they are commencing the vaccines. Oh, yes, they don't need to bother doing screening when they become sexually active.
Great.
That makes sense, right? Yeah.
Yes, sir, it does. So there's another question. I have taken the HPV vaccine in 2019. Do I need to take it again?
If she's completed the 3 doses, she doesn't need to take it again. This was once in a lifetime vaccine procedure. It's once in a lifetime. Once they've had the vaccine, that's it.
So what if she did not complete the dose? So what if
then she has to start all over again.
All over again.
Because an incomplete schedule does not offer protection.
Okay. Also, sir. Yeah. Oh, okay, great. Sir, has there been any research or anything that has given a side effect to this vaccine? Perhaps maybe because even the COVID vaccine, there are some few cases that says there's blood clot that has revealed that they got the vaccine and their blood clotted. So has there been any research or anything that no matter how small the population is, that has revealed the side effect of this vaccine so far?
Well, what we have now, and this is at least over some data, minimal side effects to this beautiful vaccine. The only side effects that most people complain about is pain at the injection site within 24 hours, and that goes away. But no long-term side effects. And again, although it's a new vaccine, relatively new compared to the polio, compared to the smallpox, we have enough evidence to show that vaccines generally are very safe when it comes to fighting diseases. When you give a vaccine or a medication or something to a large population, there will be naturally occurring diseases, incidences of abnormalities that we would want to associate with the vaccine. However, science has shown us there is no consistent pattern to HPV vaccine causing any major abnormality or side effects, apart from pain at the injection site. So I'm happy to reassure anybody who's concerned about this. Mothers have asked me, will it cause fertility in their daughters many years later? The answer is no. Will it cause them from having babies themselves? No. Will it affect their babies when they are breastfeeding? No. It's only when you are pregnant, because it's not licensed to be given when a woman is pregnant. Then we will say, don't take it when you're pregnant. However, there's no evidence that is really shown that it affects pregnancy, because women have accidentally taken the vaccines when they are pregnant, and there's not been any problem from these vaccines over time. So I want to reassure women that it's a very safe vaccine and they can take with minimal side effects. Yeah.
Great. Thank you so much for answering all our questions excellently well, sir. So there's one other question, but I'm sure maybe she didn't even, maybe she wasn't listening when you mentioned it earlier. So she's asking, where in Nigeria can the vaccine be accessed?
Okay, you can come through our Alfo Health organization, also Optimal Cancer Foundation, or if you're in Lagos, or if you're not in Lagos, you can ask your doctor, your GP. they can make inquiries for you. GSK has done a fantastic job of, creating very vast distribution network across this country now, so that any doctor who requests for it can easily get it. Most major pharmacies to stock them, but they won't administer. You have to get your nurse or your doctor to get it for you and have it administered as per the schedule. But more importantly, get screened first. Get screened first. And screening is available at our foundation at a subsidized rate on Fridays, which I'm sure Diola and our partners at Alfo can also pass the information to you. All right?
Yes, screenings are available at subsidized rates on Fridays at Optimal Cancer Care. And someone is asking if I have opportunity to ask after this webinar. Yes, you have an opportunity to ask. We're going to share our contact details after this meeting. So whether by email, DM on social media, or telephone, you can contact either us or Optimal Cancer Care Foundation. And there's another question, sir. I guess this will be the last question before we call it a day. So in the case of a tight vagina, where screening has not been possible, what do we do? That's what the person is asking.
If the woman has had sexual intercourse, there can be any tight vagina scenario here. The vagina is an elastic. We just need to look for a smaller speculum and then go ahead and do the screening. Because the speculum comes in sizes. So if the vagina is tight and the woman has been able to have sex, then it can be tight not to allow the speculum of the smaller size, because the male genital organ is designed, the speculum is designed to be about the size of the male genital organ. It's when we open it that it stretches the vagina. The vagina, like I said, is elastic, so it stretches when it's open as well. So it shouldn't be a problem. I wouldn't want to dwell on the fact that maybe that person hasn't had sex a lot more frequently compared to others. Maybe she has only had sex maybe once or twice. Then that can be a problem again, because we just need to tell her, look, don't worry about it, because your risk increases with as many sexual partners you've had or sexual experience you've had with time. So go and take the vaccine. But once you become more sexually active, when it's less painful and less uncomfortable, remember to come back and check your cervix. Does that help? I hope.
Yes, I believe so, sir. I believe so. So thank you so much for this meeting, sir. We're very, very grateful.
Thanks for having me.
We really appreciate your time. Thank you for the detailed detailed slide, detailed presentation. Thank you for answering all our questions, one after the other. Even though at some point I felt like I was bombarding you with so many questions, sir. Thank you so much. I really, really appreciate it.
Thank you so much for having me.
Thank you so much. Thank you so much. We really appreciate you, sir. Thank you, sir.
All right. So when are you having the next conversation?
We're looking at having it in May or June, hopefully, by the grace of God, if things...
Do get me involved as well, or at least let me listen to the talk and the speech, the presentation as well, because I know it's a very good thing. Let us have this conversation. Let us educate ourselves. It's the best way to deal with ignorance. It's the surest way to move people from a position of inactivity to activity. And I charge everybody who has listened to this today, make a list of 10 people, just 10. Make a list, just go through your contact list, or put something up on your WhatsApp status. There's a lot of people who like to view WhatsApp stories these days. Let's say something about HPV vaccine and say you are likely already infected, and they will say, it's not my portion, they'll reject it, and then engage them in a conversation. How do you know you have not been already sexually active? Sorry, already infected, because 80% of women will be infected in their lifetime. So if you make a list of 10 women, at least 8 of them would have been infected. Therefore, send them to screening and vaccination, and they will thank you for it. Yeah. Thank you very much, Adola.
Thank you, sir. Thank you very much, sir. So I also like to use this opportunity to recognize Lois Chibu. She's my assistant programs.
All right, Lois.
Coordinator here. Hi, Lois. How are you?
Good afternoon. I'm fine. Thank you.
Okay. All right.
Yeah, thank you very much. It was very informative. I learned a lot. Thank you very much.
Okay. So I'm just going to share my screen now and show. So we're going to post our. So So if you'd like to support us, we've shown you all the things that we do. We'd like to support us, to empower women, to promote this outreach, so that whenever we have events, you can reach out to as many people as possible. To donate, here is the donation link. We're going to post it on the chat forum. If you want to know more about cancers, know more about how to prevent them, we have flyers on our website. So you can always, so 1 second. Yes, so if you want to know more, we have flyers, we have resources on our website that you can always look through. To make a donation, you can always support us. No amount is too small. And if you want to learn more, if you want to learn, have more courses, you want to learn more about maternal health, you want to learn more about postnatal health, we have affiliate courses that are free of charge that you can learn. We have them on our website. And if you want to contact us, we're going to post our social media links on in the chat room as well. So you can follow us on Instagram, follow us on Twitter, follow us on Facebook, like our posts, share our posts, and we'll be so glad. We want to thank you for say thank you to everyone who has joined us today. We do not take you for granted. We thank you for your support. Thank you for the time that you've taken to join us today. We hope that you will join us in our future conversations. We hope you join us in our future conversations, and thank you again. Thank you so, so much. We really appreciate it. If you want to contact Dr. Femi, I'm going to post his contact. I'm going to leave his contact on the screen while I also share more information in the chat room. So we've come to the end of this Alfo Health Conversations number 3. We hope you've been, we hope you've learned, we hope we've had something, an informative, insightful message to pass across to you. Thank you so, so, so much. And so I'm just going to post this on, so you can follow us. And so, yeah. So, and there we go. So thank you very much, everyone. So there you have our links to join, to follow us on Facebook, on Twitter, on Instagram. If you want to learn more, you have it up there. And we would really appreciate your donation, to donate to us, no matter how the amount you have. And that will be all for today. Thank you so much for joining. We appreciate you. Thank you so much for your time. And we look forward to having you at our next conversation. Thank you so much. Thank you very much, everyone. Thank you, thank you, thank you, thank you, thank you, thank you.